We are super fortunate to have Dr. Stuart Shoemaker here doing the presentation for us this evening. He was a managing partner at Idaho Equine for several years. I won't go into years. He doesn't like that very much. So he's a spring chicken. We're happy to have him. And he's a performance horse guy and has also been a competitor himself and still active in the team roping and did some rank count horse things. And he's definitely been in the midst of it for sure. So I'll go ahead and turn the time over to him. And
Thank you, Katie.
All you. You bet.
Thank you, Katie. So good evening, everyone. Thanks for joining us. Hopefully I can shed some light for you on what I think is it's a confusing subject, this whole arena that has developed over the last 20 years and the use of these orthobiologics and some of these therapies that have become mainstream for us are slow to take on in the human world. So we've been very fortunate. So I'm going to try to share with you a little bit of my experience with Alpha-2 macroglobulin. And in order to do that, I think I need to share a little science with you. I don't want to make this about science. I want to make this about taking care of your horses and how you do it. I would really encourage you to ask questions, and hopefully they'll get something out of this. This journey started for me about 7 years ago. I was at a regenerative medicine conference for humans, and there was a gentleman speaking about Alpha-2 macroglobulin. And quite frankly, I mean, I did my master's research in orthobiologics and corticosteroid injections when I was doing my surgery residency. And so I felt like I was pretty well versed in the field. And here this guy's presenting about something that quite honestly, I was unfamiliar with. So after the talk, I visited with him for a little while, and that started our journey. And so this product originated in the human space, right? It's called the APIC system, APIC, in human medicine, but it is an ongoing endeavor for them on the human side. They just have not made near the strides we have in the veterinary world, getting people to use it. Most of that's insurance driven. They don't, people have to pay for it out of pocket. So I want to give kudos, and tonight we have the luxury of having my colleague and my dear friend Dr. Dan Dreyfus on the call with us. Dan is without question my right hand. He challenges me every day to be better and to think about this stuff scientifically and to try to do the best we can to learn more and more about this fascinating molecule and how we can make it a positive impact on your horses. So there are lots of other people involved. I'm not going to belabor that much, but I'm going to jump right into this, and I'm going to kind of breeze through the science because I just want you to understand a little bit why this is unique, and I think I can do that without boring you to death. So the reason that all of these things exist is because of this disease that we call OA, or osteoarthritis, and it's somewhat misunderstood as well. As a horseman, and I've always tried to be a horseman first, and then you have my veterinary thing be a support to that. I got into it. I got into med school the same time I got into veterinary school, and I just have this admiration for the horse, and it's sort of driven me, and it's been my passion for my entire career. And so this is a really misunderstood thing. When Dan and I were in veterinary school, they didn't call it OA. They called it degenerative joint disease, and the reason they did is because they didn't understand a lot of the mechanisms that go into what happens with these horses. But the gist of this is the bottom line, straight up. The second we throw a leg over our horses, we start this process. It just happens. I mean, it's the nature of the beast. If we're going to ride these things competitively and put them through the paces that we do in the different disciplines, they all get inflammatory joint disease. It is the nature of what we ask them to do. No different than human professional athletes. There's a reason they have those big ice tubs in every professional training room in the world, all levels of sports. Those athletes are doing this to themselves. And it's just part of the deal. So we just have to look at it from the perspective of, how do I manage that to the very best of my ability and protect the longevity of my horse? And I think that's what I want to point out tonight as we go through this about how important it is for us to protect the longevity of our horses. And we have had drugs in the past that we used that were highly effective, but they impacted the longevity because they caused a decrease in cartilage health. And so over the course of time, it sped up the arthritis and the horses didn't last as long. I've said this to a lot of people over the years. I said, I've probably injected a 55-gallon drum of corticosteroids into horses over my 40 years as a practicing veterinarian. And, my clients were really happy because I got them to the next show, or they made it through the finals, or whatever it is. But in my heart, I know that over the course of time, I shortened some of those horses' athletic careers, especially the ones that needed to get repeated injections frequently because they had quite a bit going on. This is the first time I've ever had anything in my hands that I felt like I could genuinely use it with impunity and know that I wasn't doing any harm. So it's a big part of why I'm kind of passionate about this alpha-2 macroglobulin thing. So really, as you think about this thing, there's a lot of things that go into it. And I'm going to point out these two things, proteases and cytokines. And we'll talk about those a little bit more as we talk about the mechanism of action. But those two things really drive this process of osteoarthritis. It can come from a chip fracture. It can come from excessive riding. It can come from riding horses too early in their career, right? Immaturity in the joint, immaturity in the soft tissue around it. But always it comes down to this inflammatory process that starts this cascade of events that eventually will wear out cartilage if it goes untreated, okay? Now, a lot of discussion about suspensory ligaments, flexor tendons, things of that nature, bursas, kissing spines, all of sacroiliac joints. These things are soft tissue driven areas, right? We rely on the soft tissue to hold these things into connection so that they function normally. And the inflammatory process that happens when those soft tissues get overstretched is very, very similar to what happens in the joint. It's just that we have to add a couple of things like collagenases, which is a protease, right? It is a protease, but it is a different protease that occurs in soft tissue that doesn't really occur in the joint. So what's important here is that this molecule is extremely effective at managing this inflammatory response, even in the soft tissue. So I think it's important to keep that in mind as we move through this thing. So as I told you, this came from the human side, and it became an FDA-approved medical device in human medicine in 2013. And originally, they thought, its original use was in spinal cord surgery. Anywhere they did disc surgeries, laminectomies, fusions, things of that nature, they were using this product to decrease the inflammation postoperatively. And they noticed that it had a profound effect. And that led them to start using it in other applications, such as knees. And knees are a really big one in humans, you can imagine. It's probably the number one joint that gets injected in people is knees. And so it didn't take very long before people were raving about how effective this molecule was. So what does this thing do? So if we think about the way most of our drugs work, right? Drugs typically intervene to block a cascade that develops an inflammatory mediator. So in other words, if you take an ibuprofen or if you take a nonsteroidal anti-inflammatory, the idea is that it blocks a pathway that creates the inflammation, right? But the inflammation that's currently there doesn't do anything for that specifically. It simply blocks the continued production of those inflammatory mediators, right? Well, this is cool. This molecule is really unique. It has three major mechanisms by which it works. The first one is it grabs these proteases, okay? It grabs the proteases and binds them so that they can be removed. As soon as it binds a protease, it makes itself more available for the cytokines. And the cytokines are the things that create the inflammation. Proteases are the things that start to chew up the cartilage and destroy the matrix that makes cartilage nice and spongy and soft. The cytokines are what create inflammation. That's what gives you the tenderness around the soft tissue in the capsule of your knee or in the fetlock of the horse or whatever. But that's the cytokines are the inflammatory mediators that we talk about. Once the protease is bound, then these cytokines get bound on a different portion of the molecule, and then the molecule changes again and gets removed from the space, which is why it's really unique. It actually removes the inflammatory mediators from the area, which is very beneficial. And simultaneously, there's this gene regulation component, which as we learn more as researchers and veterinarians and physicians, what we're all starting to recognize is that this is probably the most important thing in all of these products, is what happens at the cellular level. What happens when you put a product into there? What does it do to the cell's normal metabolism? So what we know about this molecule is that when we say upregulates, let's just say this thing turns on the gene to produce what it naturally produces in the joint. And this is a chondrocyte, so the cell that makes up cartilage. It turns that thing on to produce matrix, which is what makes that cartilage spongy. So this has been demonstrated in multiple species. We're actually in the midst of a research project right now to prove this in the horse. But I'm confident that we will, because it has done it in every other species, and the molecule is really, really quite phenomenally conserved in nature. So I'm pretty confident that that's going to happen. The other thing that it does at the same time is it downregulates or turns off that gene in the chondrocyte that's producing the proteases and the cytokines, the inflammatory mediators. So now we've got this really unique set of circumstances where we've got this product, this molecule that says, okay, I'm getting rid of all these inflammatory guys. They're going out. And I'm going to turn your mechanism at the cell level back to normal. I'm just going to rev you down, turn you back to normal, make you produce the cartilage matrix that you're supposed to be producing, and stop making all these inflammatory mediators. And it is a phenomenal and incredible approach to this, and it's just really captivated my attention. So here's kind of a schematic that'll give you a little bit of just kind of give you a little window of what this thing looks like. In its native form, it's just this big open Venus flytrap looking thing, right? As soon as it binds this protease, and there's a little bait region here, and it binds a protease, it switches into this conformation, and this is where all the cytokine binding sites are exposed, right? Once the cytokines are bound, makes one more little conformational change, and the body, the immune system essentially gets rid of it, gets it out of the joint, goes out of there. So that in my mind is an incredibly unique feature about this approach, right? So we've spoken a little bit about the human side, and I want to bring this up because I think this is really fascinating. This was published in 2020. This was done at a medical school in Upper New York called Langone Hospital. And what they did is they took 75 human knee patients. And as you know, those patients all had MRIs. They all knew they knew what was wrong with these people. And they divided them into 3 groups. They had a group that was treated with alpha-2 macroglobulin. They had a group that was treated with corticosteroids, and they had a group that was treated with PRP. And you guys are all familiar with PRP, and you're all familiar with corticosteroids. So this is a nice example of a study that was done where we've got actual feedback from the patient, right? Our deal is a little tougher because I'm still working on it, but when I get one of these things to talk to me, I'll be doing these things from my island. It's been a long process of trying to learn how to listen, right, to horses. So what happened was they used a variety of things, right, that they do in human medicine. They have all these scoring systems that are very well documented, and they rely on patient feedback, range of motion, all these things, right? So they looked at them at 6 weeks and at 12 weeks. So it wasn't a really long study, but still, it's out there long enough to know what kind of clinical effect you got. So at 6 weeks, the alpha-2 patients had by far the greatest improvement. Very interesting, right? That's a fairly rapid onset of action, right? At 12 weeks, the A2M was better than PRP, and it was as effective as the corticosteroids in the treatment of those inflammatory knees, those osteoarthritic knees. Here's the final summary, is that they said both A2M and corticosteroids have better effectiveness than PRP. These things, you can find a lot of studies, right? And you can almost find a study for any position that you want to have. But there's been a ton of work around PRP, and I am not here to bash PRP. That's not my point. the anti-inflammatory effect that's seen in PRP is directly related to alpha-2 macroglobulin. There's nothing else in there to give it an anti-inflammatory effect. And we all know that these plasma-based products, all of them will have some A2M in them. We're going to talk in a minute about why this one is unique and different, and why I think it's a better choice. But we'll get to that here in just a second. So this is a pretty simple system, and the system is designed to do two things, right? The first thing is that we create, by drawing some anticoagulated blood, we create a very, very platelet poor plasma fraction. So we try to get all of the cells that we can out in our first spin, right? So there's a gel separator and it shoves all of these cells down. Horses are the perfect model for this, because in humans, if you draw the exact same amount of blood from a human and process it the exact same way, you're going to get about 12 or 13 mils of product. That's it. And the reason is all the fat and all the other stuff that's in our diet. Horses are all professional athletes. They're all vegetarians. They don't smoke. They don't drink. They're fit. So we have this perfect plasma that comes out of a horse that makes this system really beneficial. We're actually playing around with it in dogs right now. And the reality is that's going to be a whole nother beast, because dogs have a lot of fat in their plasma. And it's going to be a little bit of a challenge, right? So the second spin is designed to remove all of the rest of the cells that might be in that platelet poor plasma fraction. And this is an important point here, to remove the cells. And then the last piece of that is to get rid of all of the cytokines. So cytokines, everybody talks about cytokines as being inflammatory. They are. They're what we call pro-inflammatory cytokines, and they do create inflammation. And it's important to recognize that. But there are good cytokines as well. The problem is, in a PRP sample or an ACS sample or many of these other samples of products that have all of that in there, you can't separate the good ones from the bad ones. So cytokines are very small molecules, and so we just get rid of them. They go through the filter and out into the waste, and so our end product is devoid of cytokines and devoid of cells. And for me, I think that's really important. I think we are after the clinical effect of the alpha-2 macroglobulin. And if I want other effects, if I want to get something else out of a therapy, I'll choose another product to use in conjunction with this. This is the absolute body's natural corticosteroid. It really is. It is the most powerful anti-inflammatory in this thing that we have identified so far in the research, and there's a plethora of literature about it. So that's not my comment. That is just the reality of the way this thing works. Okay. To date, this slide's outdated. I'm just going to tell you right now. I'm sure we're in excess of 500,000 joints at this point. Our market in Europe has really exploded. It's being used a lot in Europe, and the reasons are, I think, fairly straightforward. They have a lot of warm bloods. They have a lot of testing. They're all FEI driven contestants. So they have to be extremely cautious what's used on horses and when. And in that warm blood world, we see a lot of metabolic disease. There's a lot of those horses that can't tolerate multiple corticosteroid injections. This product doesn't have any impact on that whatsoever. So it's become a very popular therapy in Europe, and it's growing leaps and bounds as we speak. I say this a bit with tongue in cheek. We really don't have any clinical flares. There have been some reports, Dan and I get phone calls all the time from people, but the vast majority of them have been related to something else. So we just don't see flares. And I think, and I'm very confident about this, the reason we don't see the flares is we've taken all the cells out. Those cells can induce a flare because proteins have a tendency to do that. And some of the cells degranulate. When they do that, you can induce a flare. And if you get white cells into your product, white cells will definitely degranulate and create a flare. So we've been pretty adamant that we want an acellular product. And there's some differences of opinion. I mean, I've used a lot of PRP in my professional career. I've used stem cells and bone marrow aspirate and a variety of different things over the years, right? But this is my go-to anti-inflammatory because I can use it with impunity. I can treat them repeatedly with no negative side effect, and the outcomes are extremely good. The outcomes have been extremely good. Remember, there is no such thing as a silver bullet, and this isn't one either. This is a very, very nice arrow to put in our quiver to manage these horses. And for those of you that are in the competitive Western performance horse world, you guys, I mean, look, that's where I've spent my entire career and I've played the game, but we do a disservice to those horses. It's just the reality of it. I mean, we put an incredible amount of pressure on an immature skeleton, young horses getting ready to go to a futurity, whether it's cow horses or reiners or cutters or whatever. They get pounded. In the English world, so do the 3-day eventers, so do many of these other horses. The difference is they're mature, they're skeletally mature. And these young horses, we've got to do something to help with their inflammation. And I can tell you for a fact, if you start them down the road of injecting them with corticosteroids, you will shorten that horse's athletic career. It's just the reality of it. And we're all starting to recognize it. And I'm sure your veterinarians talk to you about this now. And the whole game is, can we find an economic way to manage this horse and keep him in training, right? And do the least amount of damage we can, right? So I will tell you that I think it's absolutely beneficial to utilize this product in conjunction with other things. If I have a tear in a suspensory ligament, or if I have a tear in a flexor tendon, or I've scoped a stifle and I know that I've got a meniscal tear, or I know that I've got some chondromalacia where the cartilage has gotten really soft and worn, there are indications where we want to get those growth factors that come from platelets, right? Interesting fact, the growth factors that everybody talks about coming out from platelets, those are cytokines. They're cytokines. They're just the good cytokines, right? And again, it's hard to sort out the good cytokines from the bad cytokines with products like that. So we're just hoping and using these things to try to stimulate, for the most part, getting new blood flow in there to try to help these lesions. There's a lot of discussion around the stem cell thing and how that fits into things, and it's beyond the scope of this conversation. But I can tell you now that I haven't put stem cells in a horse in probably 7-8 years. And the reason is I've been able to manage these horses with other approaches and get just as good outcomes. I think people are starting to recognize how important the physical therapy and the rehab is to getting these horses healed in conjunction with the appropriate medical management, right? So where's it used? Oh man, pick a spot. I mean, I've talked to veterinarians that have used it in some pretty crazy places. There's a veterinarian here in Arizona that called me and wanted me to help him with a young Arabian that had flipped over and broke his tail. And you know how they do, they use that tail as a rudder and they fold it back up over their butt when they flip over. And it's a really painful thing. And those horses can't lift their tail. And some of them will get to the point where they hold it off to the side. And in the show horse world, that's a bad thing. We all know that. So he treated this horse with six different injections of Alpha2 along the side of his fractured tail. And you can't tell. The horse has done surprisingly well. And everyone was ecstatic about it. And I think it was just managing the inflammation, which in soft tissue, remember, if you can stop the inflammation, you can also start to mediate how much scar tissue you get. The more inflammation you have, the more scar tissue you get. The more scar tissue you get, which is really difficult to control, you get more contracture on one side than the other. That's how the tail pulls off. And the same thing happens in suspensory ligaments and flexor tendons. The more scar we get, the harder those horses are to manage because that scar is not elastic. At least to start with, suspensory ligaments have some elasticity, so they can stretch and go back to their original form. Same with flexor tendons. If we get a lot of scar tissue, the scar is stronger than the tendon around it or the ligament around it, so it just continues to tear, and you just get this great big, you've seen them, great big suspensory branch that's as big around as my thumb and causes the horse's ankle to not have good range of motion. So this is a very interesting application in soft tissue to be able to use Alpha2. there's a veterinarian in Virginia named Rick Mitchell, very famous guy, been a U.S. Olympic team guy. And he spoke at a conference in Amsterdam last year, and I've known Rick forever. And he presented a series of horses that had chronic suspensory branch lesions that he treated with Alpha2 repetitively over the course of 6 months, and showed all of them to get much, much smaller and gave the horses better range of motion. So he's pretty adamant about the use of it in that particular set of circumstances. And those horses did not get anything else. All they got was Alpha2. So pretty interesting applications, but this control of inflammation that Alpha2 is so good at is really important. What I'm going to talk to you about a little bit when we get down here, and I'm going to just point this out because I'm sure some of you want to hear about this airway thing. And I've spent quite a bit of time on the orthopedic side, but I think it's really important. So I'm going to go through here and make a few comments. First of all, I've already said this, but you know, in my opinion, I think when you're giving these talks, what you want to tell people is you're going to tell them what you're going to tell them, then you're going to tell them, and you tell them what you told them. And then that way you get to remember it, right? Because I've said it to you multiple times. So anywhere you would use a corticosteroid, this is the body's natural anti-inflammatory. It is a very potent anti-inflammatory. That's why we see clinical effects in 3 to 5 days. And in some horses, it's dramatic overnight. It's really phenomenal how quickly some horses will respond to the treatment with Alpha2. As I said, these horses that have metabolic disease or horses that have a history of flare from injections. I've had horses in my career that every single time you injected their hocks, they were going to flare. And so you had to pre-medicate them and you had to be really careful with what you used. And they made me pull my hair out because I just hated to inject the darn things because there's a good chance one of them is going to flare. So that's a huge advantage for us in this particular thing. Horses that are performing in a regulated environment, FEI. A lot of the places where horses are being tested now, especially in California, there's a lot of testing going on at events. It can't test. It's part of the body's natural immune system. So you can use it in and around those events with no concerns. This comment right here is kind of important, and I'll leave this open and let you guys ask some questions. But what we have learned is that, so I always break this stuff. I try to keep it simple, right? Even for myself, I try to keep things simple. And even when I was doing my lameness exams, the kids, I'd ask my interns and stuff, I go, well, how much do you think that block helped the horse? And they'd say, oh, 35%. I'm like, you're better than I am, because I just kind of wanted to go 25, 50, 75, or 100. I could do that. I could categorize those horses like that, right? And I do the same thing with lameness, right? So I have 3 pots of horses that I talk about. I have horses that have acute inflammatory disease, and it's new, and it's not chronic, right? That population of horses, they do extremely well with a single injection, right? They do extremely well with a single injection. The next group of horses is what I call the repeat offenders. And that group of horses is the horses that they get their hocks done frequently. They have their coffin joints done frequently. They have fetlock disease. And inevitably, when you look at that group of horses, when you see them back again, it's not unusual to see that joint flared again. That tells us that horse has more disease than you can see on a radiograph. Those horses all have some cartilage disease. I'm just telling you, I've stuck a scope in a million of them. They all have some cartilage disease. And so why would I put something in there that's going to slow the metabolism of the cartilage and make the cartilage wear out faster? I won't anymore, because I have this. I can use this product, increase that metabolic performance of that chondrocyte, and hopefully get it to produce a better matrix. So these horses, I have a tendency to do them repeat injections, either 2 or sometimes 3 at 2 to 4 weeks apart. And some of those horses will respond well to the first one, but they won't be perfect. The second injection, you come back, you would, now that's what I was looking for. And then I'll add a third one. And what that does is it gives me that longevity of response to my injection. And that's what we're all looking for. I don't want to inject them 6 times a year, right? I really don't. I want to try to get those horses where I can manage them a couple of times a year. There's some of them that you can't get in that rein. You know, you're going to be doing it more frequently, but the goal would be to try to inject them as infrequently as possible. So that's what happens in the high demand athletes. I'm just telling you, that's what they are. They can benefit from repeat injections. And we talked about the fact that it has a rapid onset of action. So this is just to reiterate this point. Look, this product is extremely well tolerated with others. It plays well in the sandbox. It really does. If you can stop the inflammatory response right here, you can stop this inflammatory response, help those cells get back to a more normal metabolism. You can use many other things to try to help heal whatever their disease process is, right? And the most interesting one for me has come to light probably in the last 18 months, maybe 2 years, are the hydrogels, right? The polyacrylamides. I'm going to be really honest with you. I mean, I was a bit skeptical in the beginning. I'm old enough that I saw people back in the day putting some crazy stuff into joints, thinking that they were going to cushion the joints. These things aren't cushioning joints. I mean, don't think for a second that you can put a film that's a couple of millimeters thick and give any kind of cushion to a 1,200-pound horse. Doesn't make any sense. That's like saying, okay, I'm going to put this little bubble wrap on the floor, on the concrete, and then I'm going to drop on my knees. It's not going to protect you. So that's not what they do, but they do have some interesting benefit. There's something there that everybody's trying to sort through, and I'll give Contour a lot of credit. They're really trying to do a good job on the science, and they've got some really interesting scientific projects going. And so we've had discussions about, they get asked the question, I get asked the question, can you use these things in conjunction, et cetera, et cetera. And the correct answer is nobody knows. But what we do know is that there are a lot of horses that if we stop their inflammatory response using Alpha2 and we use a hydrogel, we get really prolonged responses to therapy. So I'm not a salesman here. I'm not trying to, pump anybody up or anything. I'm just trying to give you guys some reality about what's happening in this industry and who's doing what, right? And you guys have probably had that happen. Some of you guys have probably had hydrogels injected in your horses, and they have my undivided attention. Let me put it that way. So, what's the difference? And this is back to that. I'm going to tell you. Here's a difference: cells. It's cells. We want to get rid of the cells. We want to get rid of the cytokines. And when we do that, it allows us to do this. We can freeze it. You can't freeze those other ones because as soon as you freeze them, the cells rupture, and then the cells either have a negative impact because they've ruptured and turned out things that are really inflammatory, or they're no longer functional, right? So taking the cells out allows us to freeze this product for all the way up to a year. And I just haven't looked at it beyond a year because it's really difficult to get samples. I mean, nobody has them a year, It took me a long time to get enough samples to feel like I knew what they looked like at a year because I used all clinical samples and they just weren't there, right? People didn't have them. So this is the difference. It's an acellular product with no inflammatory components to it that is relying on alpha-2 macroglobulin to do its anti-inflammatory effect. So that's really the key differences, guys. And I don't think I can make it any simpler than that. So this is a little bit redundant because we've already been down this thing. Bottom line, sometimes it's just as important what's not in the product as what's in the product. And I think that summarizes kind of some of the other stuff we said. So here's what I'm going to spend the next little bit on, this airway nebulization thing. So here's the deal. I had a trainer in Florida, racehorse thoroughbred guy, big time thoroughbred trainer, call me and say, hey, have you nebulized this? And I said, no, I'm still working on the orthopedic side. No, I haven't even thought about it. And he said, well, I have. And he goes, I've got 2 horses that have been ruled off the racetrack for bleeding, and they're both at the track. And he sent me wind pictures. And I'm like, really? What'd you do? He goes, I just put some in a thing and I nebulized them and they did good. Well, he didn't really have a protocol. He just kind of made up something and did his deal. So as time went on, Dan and I started getting increasing amounts of inquiries about nebulization. So quite honestly, this was a bit of a defense mechanism. We felt like we needed to get out in front of this because we knew that in the horse world, as soon as somebody says something works, everybody's going to try it. And we really wanted to know if there was any kind of negative side effect that we needed to tell people about, right? Is there something doing this that's not positive that we don't want you to do it because I don't want you to hurt your horse, right? So here's what happened is we did this study. We did a pilot study, and I'm going to pull these up here. We did a pilot study and we got 50. We started with 54, I think. We only got the data, complete data sets for us to analyze on 36 or something, right? And the problem was the horses did good and they didn't come back for the rechecks, right? Or the veterinarians didn't get all of the data that we needed to enter into our statistical evaluation. But here's horses, and what the reason we chose these horses is asthma is a huge issue. Inflammatory airway disease affects over 80% of the horses that are in performance. You guys all know, you're all horse people. Hell, you know, they live in a bad environment. We throw them in a trailer, we haul them down the road. We always throw hay in there so they got something to nibble on. They got stuff aerosolized all around them. We run in arenas where there's dust. They live in a pen where there's dust. They are constantly inhaling things that can be irritants, right? So asthma, as it's stated, is a spectrum of disease again, right? It's not just the horse that's standing there wheezing because he's got, you know, COPD like severity. But we all know about those horses that cough when they run. We all know about those horses that might want to bleed a little bit when they run. And it's a huge issue for us. So we looked at these horses and we graded all these horses for their asthma symptoms, right? And this is a grading score here on the left. All the way up to 16 is bad. There was a couple that were above that, but these horses can't really do anything. They're basically standing there panting for their lives, right? They're that severe. We nebulized these horses, and I'm going to pop this up for you real quick. We did a series of 6 nebulization using 3 mils of the Alpha2, and you have to dilute it to 6 with saline so that you've got a product that is going to gum up the filter. The Alpha2 has quite a bit of protein in it. That Alpha2 is a large protein, and so it'll kind of gum up the filter. But when you dilute it, and we dilute a lot of the other things, I mean, any of you guys that are using, you know, essential oils or any of these other things that people nebulize their horses with, we have to dilute them. Otherwise they screw up our filter. So we diluted it to 6 mils with saline, and we did that nebulization every other day for 6 treatments. So 12 days, right? And that's important because when we looked at these horses was post loading dose nebulization, right? And this is a pretty standard response. They had to improve greater than 30% on their clinical score, and they had to go below a score of 7. And you can see there's one group, here's another group. Look at the response these horses had. 88% of the horses in our pilot study responded favorably. Now, here's a problem. Research is just, it's tough because you want to try to control all the variables you can so that you're making assumptions that are accurate, right? Well, first of all, we did not do BALs, bronchoalveolar lavages, on every single patient that was admitted. That would have been time consuming. It would have been horribly expensive. And we were trying to get out in front of this thing, wanted to make sure we didn't have any problems, right? So we didn't force that. Although quite a few horses had them pre-treatment, we just didn't force them to do them post-treatment. But we did get some. We did get some, especially from Europe, where they did their BALs afterwards. And the results were so compelling that we funded a study at the University of Georgia with Dr. Michelle Coleman, who had been at Texas A&M with Noah Cohen, and is an internal medicine specialist in the respiratory field. And they have completed our blinded clinical trial on their asthma herd, and we're simply waiting for those results. And as soon as they're available, we'll make them public. We'll publish them. The girls will do all the social media stuff that I don't know anything about, and they'll make it available to people, right? So we're optimistic and hopeful that those results just continue to perpetuate this. Here's what's cool. I get a lot of people, and I know some of you on here are our sponsored writers, and thank you guys. And I would really welcome your input for people. But once those horses have been quieted down, you can keep their symptoms in the vast majority of these horses. You can keep their symptoms completely at bay by nebulizing them intermittently, right? And everybody's got a little different plan about what that looks like at this point, because some people are doing it before every run, 3 or 4 hours ahead of time. Some people are doing it only when they go on multiple day events. But there's horses in this group right here that were so severe that they couldn't do anything, and they remained asymptomatic for longer than 6 months. And none of us have ever had anything in our hands that gave us those kinds of responses. Even with the good drugs, like, we had a servo, and we can nebulize albuterol, and we can do all these things. Nothing lasted like that. And I'm going to tell you guys that goes back to this thing right here. I promise, when this thing's all said and done, we are going to find out that we get some kind of regulation, some kind of modulation of those respiratory epithelial cells, the cells that line the lungs. That's who's producing the stuff that makes them cough and makes them do all this stuff. Those cells are pissed off. And once they're mad, we've got to do something to down-regulate them, or turn that mechanism off and turn their normal mechanism back on. And I truly believe that over the course of the next few years, this is not easy research, guys. It takes a long time to do this. And it's not easy to do. And there's only one place in the United States that cultures respiratory epithelial cells, and that's Dr. Noah Cohen's lab at Texas A&M. So not easy, but we're going to do it because we really want to know, and we really want to help horses. And so I think that's a pretty good summary. There's a bunch of volumes for injections that I can share with you guys, but that's kind of a veterinarian thing. And I just soon field questions and talk to you about your horses and give you some ideas. And don't be surprised if you ask me about a horse and I say, this isn't necessarily my first line of defense, because the first thing I'm gonna do is try to be honest with you. So thanks for your time. I hope I didn't bore you to death. But this is it's a really exciting field. And I think what you'll see over the next few years is people will start to recognize, we'll find out more of these things. This is just the first one. The cool thing about this, really cool thing about this, it's part of the immune system. This molecule is part of the immune system. And that's why I think it's going to have a variety of effects across a broad range of body systems. So in humans, they're actually talking about this in some of the neurodegenerative disorders, right? Alzheimer's, Parkinson's, where they have those plaques. They found alpha-2 in those plaques. What nobody knows is it a cause and effect, right? Did the alpha-2 go in there to try to quieten down the inflammatory response and creates this thing and gives you the plaque or whatever? But alpha-2 is starting to be recognized as a very powerful modulator of a variety of cell actions. And so there's a lot more to come. And, we're trying to be the leaders. We're trying to be the people out in front and try to get everybody good information and do the best we can to help horses. So let's have some questions.
I have a question regarding nebulizing it. So I have a thoroughbred who roars, and he's a grade 2B, so he's partial. Is that something that could help him? Because he gets nebulized before fitness gallops. He's a 2-star FEI, intermediate 3-star cross-country horse. And when he makes the noise, obviously at FEIs, people look at you a little funny. But is that something that could potentially help any inflammation he's got going on because of that defect, if that makes sense?
No, it makes perfect sense. And so you make a good analogy there. So what happens is, as you know, so this is the larynx, right? Mm-hmm. And so in a normal horse, that larynx is going to crack way open like this to give you the widest thing. He only gets to here.
Yep.
Right. So he's got one side that doesn't go all the way. So what happens as he exercises is the negative pressure of him breathing through his nose. And it's one of the disadvantages of horses because they are obligate nasal breathers. They can't breathe through their mouth, right? So the pressure of the air going through, it creates a venturi effect. And so what happens is this side's open, but this side starts getting sucked across, especially as he gets fatigued, right? So it will do nothing for that. It won't do anything for that. But you are correct in that because of just the airflow mechanics, he's going to get some inflammation. right? He will get some inflammation, and it can help with his lower airway inflammation and probably help with some of the upper airway inflammation. One of the things that we haven't looked at is in a lot of these horses that have airway disease. So we break our airway disease into upper respiratory and lower respiratory, right? And so the upper respiratory stuff, there's a lot goes on in that big old long head of theirs, and those nasal turbinates and that soft palate and that area of the back of the larynx that creates inflammation. That's a real problem for us. And we haven't even looked at whether nebulizing alpha-2 helps with that inflammation. But theoretically, absolutely it could. So I don't know that it'll make a big difference for him, but I guarantee you it's worth a try.
Because that could be a really interesting thing. Because I know a lot of upper level eventers struggle with recovery after galloping, especially on these longer courses, that I think that could be very helpful to kind of help decrease that inflammation after they've just sprinted for that amount of time.
Not only that, but if you think about it, you've got to get them prepared to do that. Mm-hmm. And so you will have created some inflammation along the way. So if you can knock the inflammation down pre-event and then follow it up post-event, the game for all of us in all of these things, especially in performance horses, is we want to avoid the peaks and valleys, right? So we want to stay away from that place where we get to the top of the inflammation curve and then we go down and then we go back up. So we want to try to keep things as modulated at as low a level of inflammation as we can. And I tell my clients all the time, that's all we're doing with the damn joint injections. That's it. I'm just playing the game, right? I'm just trying to keep their inflammation below the point that it's clinically affecting them. And that's the entire game. And that's exactly what you're describing here. So I think a series in a horse like that, and then using it pre-event and even potentially post-event might be very interesting. And you could easily do that with one kit and just see what kind of responses you get.
Yeah, because I'd be very curious, like in our format, on our longer FEI format, we run cross country, which is the full gallop for like 11 minutes before we show jump. I'd be very curious to see how that helps them recover post galloping before they have to show jump the next day.
It would be a very interesting experiment, yes, for sure, and I think a logical one as well. I mean, I would tell you if I thought you had no chance, but there is a great deal of logic in your thinking there, and I think it's a really interesting idea. I hadn't thought about that, but I think it's a really interesting idea, and I certainly would try it if I was in your shoes.
Okay, I will definitely try it. That's what I was thinking of when I saw the post for nebulizing, is just that general inflammation from, like at Kentucky, they run these massive courses that are 11 minutes and you can hear all the horses kind of struggle. If that would help them recover a bit faster to get going on the next day.
You bet. And remember, the environment plays a big role in this too. You know, you get the humidity. Now you got another variable to deal with. And so all of these things can sort of snowball into creating a worse inflammatory situation, right? So I think that's a great idea. No, thanks for bringing it up. That's a really interesting thought.
I have a random question that just kind of popped in my head. Have you started using any sort of Alpha-2 for like a wound trial? Specifically like in a soft tissue wound?
That's an excellent question. That's a great question. I'm only chuckling because Dan and I had this conversation just a couple of days ago about a research project. So here's what I can tell you is that there is absolutely no question. Yes, there are some people that have used it, and there's absolutely no question that it will help a wound. Zero question in my mind it'll help a wound. And how to use it is what I don't know. I don't have a protocol specifically for it yet. Topical application, obviously.
Yeah.
Under a bandage. That's the things we don't know yet, right? But we are definitely interested in looking at that.
So this specific horse, I've been dealing with wounds that won't heal for 9 months now.
Where is the wound?
On the front of the cannon bone. Okay. And it's actually with Dr. Fabio.
Yeah.
we did surgery on it in March, and when we did that, we actually injected PRP into the wound. And so like then I was just like, wow, why haven't I tried this? But I also didn't know if there was a reason
So
why I
did he
haven't
have
tried.
was there a sequestrum? Is that what Fabio took out? You had a sequestrum, a piece of
No,
bone?
there wasn't one. It
Oh, okay.
presents like a sequestrum, but like we cannot find one.
Okay. Is it directly over the flexor tendon or the extensor tendon?
Yeah, so currently the horse is in a cast. She's been in one for about 12 weeks, and that seems to be
Yeah.
the only thing helping. But I was just like, well, I'm willing to try anything at this point.
So do you just have like a bivalve cast on her you take on and off?
No, it just is staying on, and then if we can reuse it, we do, but we've been
Okay,
having to
gotcha.
replace it because it's just not functional to re-put it
Right.
to
Well, look, I'm happy to chat with Fabio. I'm still down here, so I'm not going to leave and go home back to Idaho until next Tuesday. So I'm happy to go and visit with Fabio. But yeah, there's absolutely some rationale behind using Alpha2 on that thing. And if you're going to have it in a cast, which I was going to say, in my experience, before I had this stuff in my hands, I had some of those, and I'm sure Dan did too, where they weren't going to heal unless I had them in a cast. That tendon movement underneath there just disrupts the bed for your granulation, and they just flat will not heal. And it's not all of them, but when you get one, man, they are a pain in the caboose.
There have been some wounds like that people have injected small amounts of the Alpha2EQ just under the skin, right off the edge of where it is
The
kind of
granulation
stalled
is, yeah.
and won't continue to heal. And it kind of kickstarts them and they go ahead and heal over. So that's one technique that's been effective until we come
And
up with
I think
something
that's
more clever.
Right. And I think that's, if I was going to do that in your horse, that's exactly what I'd do, is I would infiltrate along the margins of the wound, and then I would take some and put it topically. And the problem with the topical is trying to keep it there, right? That's the issue with just putting it on top of the wound. It's hard to keep it there. And that's why Dan and I don't have a specific answer for you, but I'm happy to visit with Fabio about it a little bit.
And then keep us posted.
So I have a question, Stuart.
Yeah.
So many people that we're nebulizing the horses for, or processing for nebulizing, they've bled, and their whole objective is to be able to get them off Lasix. And
Yep.
That's kind of a gray area for me talking to them about it, because I feel like if they treat them and then take them off Lasix and they bleed, then you feel like the product didn't work. And I don't know exactly how to explain that to them, that it's not, I feel like, and correct me if I'm wrong, it's not preventing the bleeding, but potentially, explain to me how I should be explaining that to them with the Lasix, whether they should take them off or not.
It's a bit cheating because I know you guys so well, right? And I know your husband's a very talented veterinarian, and so he and I have had this conversation some. The question, and your question's a really good one. How do you handle it from the standpoint of convincing someone that this product is the thing to use, and where do you draw the line on the Lasix? So here's my comment, and then I'll ask Dan to weigh in, because Dan spent his entire professional career working on thoroughbreds and racing individuals. Although I did a fair amount of that early in my career, most of my career has been around the Western performance horse world. So kind of come at it from a little bit of two different angles. Okay. So in most of the Western performance horses, I think the underlying cause of EIPH is more than likely, the highest percentage of them are because of chronic inflammation in the lung. Okay. I think those are inflammatory airway disease horses that get pushed and then they have a bleeding episode. It's a bit different in a racing thoroughbred. I think the mechanism of action of bleeding in a racing thoroughbred is different. And yes, we can say that barrel horses are similar to race horses, but I'm going to throw a curve at you. They don't exchange air when they're running. When they're running a barrel pattern, they ain't breathing. They're going like a sprinter. They go, They don't change air in their lung like a racehorse that's running and has to rate stride length with respiration. I just don't, I mean, I've proven this to a bunch of people that thought I was crazy, but they don't. They just, they're breathing, but they're not exchanging air. So that inflammation is allowing the lung to be fragile, and I think it breaks those small blood vessels. So if we can control the inflammation in those horses, what I think happens is it's a spectrum, Jennifer. Like, so if that thing's been bleeding for a long time, I wouldn't have them take them off Lasix. I damn sure nebulize them, because I think I can control their inflammation and make them less likely to bleed. But they've already gotten to a point where that's a problem, and so using the Lasix is can be valuable. And you know what a setback it is when they bleed. So some of them, I think I'd be a little cautious in saying, yeah, you can take them off the Lasix. If you get them free inflammation and you get a nice window of time where you can knock their inflammation down and get those horses back to a normal thing, then I think you can say, okay, well, I'm going to remove the Lasix and see how I do, right? But in the midst of the battle, man, even as a veterinarian, that'd be a tough one for me to say, no, don't treat that horse with Lasix, because it's such a setback that I would be cautious to remove that. So the concept is basically, I think they really desperately need a loading dose. And then those horses that have had that, they need to have more regular nebulizations to keep that at bay, because they've already demonstrated that they're reactive to something in their environment. I don't know what, we never do. I wish we did. I did have one here in Arizona that absolutely was mold. Got his environment changed, got him nebulized with Alpha2, and after his 6th, he's completely normal. Completely normal. He's a heel horse, but still, I mean, he was having a heck of a time.
Yeah. Yeah. No, that makes perfect sense. Thank you.
You're welcome.
I have one more question, kind of circling back to suspensories. I know we had talked about how it's really helpful to kind of prevent the scar tissue. Is this something, if I have a horse in my barn that was a steeplechase thoroughbred and came with an undiagnosed tendon that has pretty intense scar tissue, is this something that would help that, putting it in, or is that kind of a lost cause once you get to that point?
It's a flexor tendon, like a superficial?
Yeah.
Okay.
Yeah.
Is it like mid-cannon?
Yes.
Okay. So that tissue will behave very similarly to the suspensory branch example that I gave you. Here's the difference. If you look at most suspensory branch injuries, the fibrosis is around the ligament, right? It's not within the fibers. It's around the ligament. So you get this big bulky suspensory branch that fibrosis creates a problem with range of motion, et cetera, et cetera. And so I inject those horses fetlocks and their suspensory branch, right? At that time. And I think most veterinarians do. In one like this, I would not hesitate to infiltrate it peritendinous along both sides, all 3 sides, medial, lateral, and on the back with Alpha2. But I think you would have to do it a minimum of 4 times to start to see any change. And if you're going to try it, then ultrasound it, see what it looks like, because you can see that on ultrasound quite nicely. Honestly, I mean, these new ultrasounds are so incredible with the detail that they give us that you can see those things. So if you're going to try that, do at least 4, and maybe more, just depending on what kind of response you get. But I would definitely try it and make sure you get the entire length of whatever that fibrosis is, and do it on the inside, the outside, and down the back.
Because I know, like, when they first got the mare in, they had treated it kind of that traditional way, with the PRP, rest, shockwave, all that kind of stuff. And it keeps coming back after a certain point. And they had ultrasound it, but when they did the UTC scan showed more scar, like it hadn't actually healed. The scar tissue had just gone around it. I wonder if this would help, if we did it the 4 times, did it around it, help actually heal it.
So I have a friend who I think is an incredibly good veterinarian. His name's Steve Hardy. He's in Eagle, Idaho. And his practice has always been jumpers and dressage horses and stuff. And he's a very, very smart guy. And so Steve, I actually go there and do quite a bit of work. I still look at a few horses here and there, and I always go to Steve's, and it's just because I really like him. It's just literally down the street from my house. So Steve and I spend a lot of time together. Steve started, he sees a lot of suspensory injuries, and he sees a lot of body and upper origin suspensory injuries in his group of horses. And he called me right before I came down to Arizona. So late October, early November. And he goes, he said, I have these horses that I have traditionally, treated with their inflammation with ice and maybe some systemic steroids and blah, 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 blah. And I rest the bejesus out of them and put them in there and put PRP in it. And I do all these things. And he said, so I decided I was going to do these things with Alpha2. And he said, what I found that's interesting to me is I inject them with the Alpha2, and their inflammation and their clinical lameness improves really fast. And he said, when they come back for their 2-week evaluation, he said, some of them still have a little bit of sensitivity and some lameness, but he goes, I always inject them a second time at 2 weeks. And then I look at them at a month and I just inject them again. I just do it again. And he said, I'm telling you, Stuart, I have shortened the interval of treatment to rehab in those horses, and their ultrasounds are improving. So I believe that there's something going on, not to go back on the research thing, but one of the things that Dan and I are looking at North Carolina State with Dr. Lauren Schnabel is we're looking at what does this molecule do to cartilage cells, the cells that line the joint, synoviocytes, and what does it do to tenocytes? What happens to the tenocyte? Does it have the same impact on the tenocytes to change and have them change their metabolism and start producing normal matrix? Because that's what they do too, right? Every cell has a function. They all have a byproduct. Every cell in your body makes something, right? Whether it's keratin in your skin, whether it's the lining of your gut or tendons or cartilage or whatever, they all have a product that they make. And if this thing influences that gene regulation and tenocytes in our culture, then I think we've got really good evidence to suggest this is an important way to help modulate the healing of those things. I'm not saying it'll take away the use of some of the other things. All I'm saying is I'm pretty impressed at some of the responses that we have seen in some pretty static chronic soft tissue injuries like tendons and ligaments.
I do have a question. It's a fairly simple one comparatively, but I'm just wondering, I'll be using Alpha2 in my horse's coffin and hock joints for the first time at the end of the month. She is currently vitamin E deficient. We are working on it.
Okay.
I know with the filtration process, you said most of the cells are taken out. I just want to make sure there'd be no impact to the effectiveness of it with that deficiency.
No.
Okay.
No, there's not anything. There's not anything. And especially if you're supplementing her,
yeah,
I'm assuming you're supplementing her and probably using a platinum product or something like that, right?
Yeah.
Or a good vitamin E supplement. No, there should be absolutely no, and we don't know of any, and there's certainly not anything reported that vitamin E deficiency will affect the body's production of that. It shouldn't have any impact on that immune system at all. So
okay.
I think your product will be absolutely fine.
Okay, perfect. Thank you.
You're welcome.
So I injected a whole ton of joints on my stud. And is it more effective in some joints than others? Because it seemed like he was a whole new horse in his coffins and his back and everywhere. But his hocks, we had to go back and do more and more. Yeah. Do you think it's just because that joint is used more when turning a barrel, or just it didn't take as good there? Or
well, so that's a good question, honestly. And here's the deal. Hocks can be a bit sticky. The issue with hocks is they're a low motion joint, and I've MRI'd so many of these hock horses that the radiographs, they're not as bad as what the patient's clinical picture is. And I know it's their hocks because I can block them sound in the hock, right? I know I can eliminate that deal by blocking them. So I've stuck a lot of those things in the magnet, and every single time I do, I find more disease in there than I ever thought I'd see on the radiograph. So he probably has a lot more disease in his hocks, whether it's radiographically apparent or not, than what we realize. And so then at that point, we're starting to run into that deal where many of them have sclerotic bone in those small hock joint bone, the small bones of the hock.
Okay.
And those horses, in my experience, are the horses, and I'm not a huge user of osphos, the bisphosphonates, but that's one place where I think they do have a profound impact on those horses, especially those chronic, hard to respond horses. And I think and some of the navicular horses are the same doggone way, right? That navicular bone gets sclerotic. And so bone is supposed to compress, right? And it's tiny little amounts, but it is a compressive piece of tissue. And when it gets sclerotic, meaning it puts down more bone and it gets really dense bone,
Right.
then they build up pressure within that bone, and that's like a compartmental syndrome. And those things are painful. And that's where I think the osphos seems to have an interesting and sometimes a profound effect on that group of horses. And I will add that to those chronic navicular horses that just have bad radiographs, and I may inject their bursa and their coffin joint and give them some osphos. And that in my hands has been, I'm just controlling the local inflammation with the alpha-2. And I don't know about what's going to happen in the bone thing, but they can be a real challenge, Summer. And you're not the first person to ever say that to me, for sure.
Perfect. Thank you. I appreciate it.
Yeah, you're welcome.
And I know for sure my horse is one example that x-rayed. She still x-rays clean for years, but after a CT, and she's one that one injection in her stifles and neck do great. Her hocks, we do a series of 2. And then we've also, she's had some suspensory injuries too. And I've followed that Alpha2 up with another product with more growth factors too. But
absolutely,
she's definitely one that's x-rayed clean, and it took us a long time to figure out where the alpha needed to go and how many times.
Exactly. And the repetitive injections can be really valuable. And it's frustrating when you're in that spot. But I am telling you, in my lifetime, we are still going to be using combination therapies, all of us, because we're going to need to use multiple modalities to get those more difficult patients to a place where they have some comfort that lasts, right? So don't hesitate to use more than one modality, right? Sometimes the joint injection is not going to get us where we want to be.
I will say though, as far as nebulizing goes, I can promise you there is nothing that beats the Alpha2.
Thanks for saying that. It's pretty cool to hear that from you guys, because you guys are the end users, right? You guys are the ones that know how the horses do. And that's the stuff that Dan and I love to hear. And look, I'll tell you, I don't know if you guys have heard this or not, but Boehringer Ingelheim is no longer going to make a servo. They're going to sell out what they have, and there's not going to be any more a servo on the market. So that leaves a big void for us that are products that are approved that have had some research behind them to really help these horses. And I mean, in my hands, the a-servo certainly is a very nice rescue inhaler, but it doesn't seem to give me any longevity, right? And that's why this series and changing this inflammation in the lung is really, I think, going to end up being a really important method for us to manage these horses. So having someone like yourself make those comments is really, really encouraging for us. So thanks. Excuse me.
I'd love to share my nebulizing success story as well. I know Carrie and Katie probably know, and I don't know if they pass this on to you, Stuart, but my horse is a really bad bleeder, and we found out that she has a congenital defect in her lungs. She has 4 bad, so there's not really anything we can do to change that. It's just going to be a thing. And it was actually when we were in Vegas for the NFR, she was bleeding really bad, and out her nose, but then also I was basically running every other day and was getting scopes every time after she ran. And I could physically see the difference of the redness, irritation, inflammation going down in her upper airway. And then when I got back to Arizona, I did a BAL. And I didn't have like a BAL before I started nebulizing in Vegas, but I had a previous BAL with similar symptoms where she was bleeding really bad. And her neutrophil levels were at 85%. And then when I did this post Alpha 2, they were at 15%, but similar symptoms, similar bleeds. So I thought that was really cool that we kind of had something to compare it to and could see the inflammation level like was very drastic using Alpha 2, and then like prior I had not used that.
Right. That's awesome. That's really cool to hear. And I think it speaks to this comment about the potential of us being able to change the way those respiratory epithelial cells are behaving. We have a number of veterinarians especially in the UK, that have adopted the nebulization of Alpha2 in their practices. And a couple of them are inventors themselves. And so they did the BALs before and after, and they have reported that their BALs went from very abnormal to 100% normal. So those are small numbers. We're very anxious to see what the results from the Georgia study are, but I do think if the more we do to reduce those inflammatory cells down there, the more likely we are to have a positive impact on the bleeding. So that's great. You also have very good veterinarians, so you're in good hands.
Yes, I'm very lucky. Big shout out to Dr. Leitman. She is doing
She's
incredible
special.
things
Yep.
especially from the respiratory standpoint. So I am
Yep.
so thankful
Very,
to have
very
her on my
smart,
team.
very smart lady, and been a real pleasure to work with them. So yeah, I agree with you.
Talk to Carrie about a horse we're going to try this on. I don't believe he's technically like navicular as far as the bone readings go on radiographs, but he's got the navicular bone edema syndrome or whatever, the bone bruising.
You bet.
And we've kind of thrown the book at him in a way of doing PRP and shockwave, some therapeutic shoeing with the dental impressions. I think at one point we did some aluminum bar shoes with 4-in pads and, corticosteroids and stuff. But I've always focused on a regenerative approach in maintaining my rope horses. I'll use steroids where necessary, like you said, about combining, therapies, including like shockwave, AccuScope, any of that stuff. I'm game, but I really like learning. So that's why this call has been really interesting. But you mentioned using like the navicular horses being a challenge. And I know specifically I've learned that this bone edema deal can be a real pain in the butt.
Absolutely.
So like you mentioned a second ago, I think about doing like multiple doses over several weeks.
Yep.
I guess I don't know if you could expand more on that maybe, or even add in like your thoughts or opinions on because I'll go down a rabbit hole of, which one to use, like shockwave or something else with it. Like, what's your favorite regenerative approach in combination with A2M?
In that particular area, here's what's crazy about that, right? Like the back of the doggone navicular bone is cartilage, right? It really, it's cartilage. It's a little different than the cartilage we see in the joints, but it's still hyaline cartilage, and it has to be there so that the flexor tendon can slide across the back of the navicular bone, right? Well, these horses, when they get that bone edema, the bruising bone phenomenon, that can be an independent deal where it's the only reason that they're uncomfortable is that they have that bone edema and that bone is painful, or they can have bursitis to go along with it, right? And most of them ultimately do end up, pardon me, with bursitis. So that little sac that sits between the back of the tendon, between the tendon and the navicular bone, holds fluid in there, right? So what I think the important thing I'll make a couple comments. One, I think it's a great application for Alpha2. And I have had horses that didn't respond as well as I'd hoped they would with the initial injection. Full disclosure, I'm no different than anybody else. I don't get to fix them all first try, right? And but I do think that putting the Alpha2 in there is really important to stop the inflammatory process, and in particular, make dang sure those proteases don't start to damage that cartilage on the back of the navicular bone. So a series of injections in that group of horses has been beneficial in my hands. I oftentimes in those bone edema horses, that's where I'll grab some Osphos. I really think that it has an impact on that group of horses. There's a veterinarian in Kentucky, Dr. Liz Sanchi, and she's an old friend of mine, and she doesn't do anything but young thoroughbreds. And I asked her to look at the use of this. They look at all these yearlings, and they're starting to look at them younger and younger now because they're finding these OCD-like lesions, right? Or developing OCD lesions. And I just had a call with her this last week, and she told me, she goes, all right, I thought you might be full of it, but I've got a group of horses that I can tell you in past, those radiographs, they were going to develop more significant OCD lesion. And she said, with a series of Alpha2s, I've stopped that. They heal and they look normal. So there's something there. There's something there. And I do believe that, there's a lot yet to learn about it, but I wouldn't hesitate. I'm a little reluctant to go into those bursas at 2-week intervals, just because that's one of those places we're down on the ground, we're close to all the dirt. I mean, we do the best we can to prep them and get them really good, but that's a spot. If you get an infection from something, that is a disaster. It's also the reason that I would choose the Alpha2 over some of the others, because we don't see the flares. There's no cells, and it's part of the immune system. And I promise you, I've used it a bunch in septic joints, and it is really helpful and beneficial in septic joints. So I think that it reduces my concern about multiple injections into a bursa because of the way the molecule works. I've just kind of gotten away from putting cells in that region. Like, I don't put PRP in coffin joints anymore. I don't put PRP into bursas anymore much. I just use the Alpha2, and I feel like I get as good, if not better, results there. Now, there's other places where I dang sure combine the two of them, and I'm not afraid to do it. I'm going to bring this up, and you need to talk to your veterinarian a little bit about this, but this is another place where I have had a lot of people tell me they've used some of the polyacrylamides, in particular the Arthromed product, in that capacity. I've not done that.
We've used that. I tried it. I've used Osphos now a couple of times, and just doing that on a 6-month basis. And then the Arthromed we did back in 2022, like June or July. And I just didn't see a big improvement with it. And so I didn't do it anymore after that. Maybe it's one of those things I need to do it more again. But like I said, we've gone and even injecting into the bursa down there, the big thing, I know the 2 different vets I work with, one's in Arizona, one's out here in Texas. And it's just the concern of going through the flexor to get into the bursa, right? So
there is some concern about that. And actually, when I had my MRI business, Bob Schneider and I did we did a bunch of MRIs on some horses that we had repetitively poked the deep flexor tendon to go into the bursa. We wanted to see what it looked like. I mean, I've had that concern for a long time, and that it's surprising to me they tolerate it quite well, right? They tolerate it surprisingly well. I don't think a guy wants to do it, every 2 weeks, but it doesn't stop me from sticking a needle into the bursa. Let's put it that way.
Okay.
So, and you would hopefully get a better response doing a hydrogel after Alpha2.
Well, it's funny you bring that up. I actually was wondering about that, and I'm happy. Look, dude, whoever you're working with right now, I'm happy to have a conversation with them, and we can kind of see if we can bang our heads together, and maybe we can come up with a plan. But So like I told you guys earlier in this conversation, you know, I've had lots of conversations with the people specifically at ArthroMed, because they've approached me. They're just like, hey, what do we say to people, right? Like, what do we say when somebody says, you know, why would I use Alpha2 or why would I use this? And can you use them in conjunction with one another? So we've got a nice dialogue going, and we're really trying to be super professional about helping each other figure out the best methods for treating. And so far, what I seem to have gleaned from the veterinarians I've talked to that are using them in combination, I'll tell you, there are a few guys that are putting them together in the same damn syringe. And I'm not sure that's the right approach, but I've had numerous people tell me that if they treated them with Alpha2 and followed with the ArthroMed, that they got a much longer response. And that'd be a good conversation to have with JD. And I'm happy to do it, man. I'm happy to visit with him.
Yeah, thank you.
So I'm going to throw something
that would-
crazy at you. And this is something that I think, you know, probably beyond the scope of this call, but we can get on the phone with JD and have a conversation. One of the other ways that people have been using, and we actually funded a small study doing regional limb perfusions with the Alpha2.
Oh, with Alpha2? Cool.
Yeah. So the tourniquet and then do original limb perfusion. The concept behind it, if you think about it, is, you know, that foot, there's so many components there, right? To your point, right? A steep hoof wall, you know, if you get some laminar tearing on the side, you know, that you can't really see, but that causes them some discomfort. You've got navicular bone edema, you've got these other things. And as soon as they start loading differently and loading more toe heel than they do heel toe, then, you know, the foot, the performance of the foot and everything changes, right? And when you give it in a regional limb perfusion, you can put it in the bursa and do a regional limb perfusion. Now you're getting the Alpha2 to the entire tissues of the foot, the collateral ligaments of the coffin joint, the, you know, the around the bursa, the suspensory ligament of the navicular bone, the lamina, all of those things you can get some response. And that would be an interesting conversation for JD and I to have.
Awesome.
Cool.
Well, thank you. Thank you very much.
Absolutely happy to do it, man.
The other thing you said that was really cool is I've got a horse that I've had a suspensory branch on that front lift that's been a bit of a chronic pain, and I know ultrasounding out looks pretty clear, but a lot of what you said in the talk earlier about scar tissue and even a comment you made, I think somebody asked a question or whatnot, you said on just injecting it and doing different things around that definitely piqued my interest for that horse. So
I guarantee if you do a series of those things around that chronic thickened suspensory, that will change over time. And it doesn't happen overnight, dude, but it definitely will change, especially with a series of injections. And the cool part about it is, man, you can inject them one day and ride them the next day. I mean, it's not like it's not like there's a great big layoff period. You're asking that product to go in there and help with that chronic inflammation and remodel that scar tissue. And I mean, Rick Mitchell, he deals with a lot of them, and that's a smart guy, and he wouldn't stand up on the podium and at a big conference and make those comments if he didn't believe it.
Right. Okay. Cool. Thank you.
Yeah, you bet. Okay. Well, thanks everybody. Really appreciate it. And as I said, if you guys have questions or comments, please make them. They help us. They're beneficial. Dan and I genuinely want to hear them, and we take them very seriously. So whatever comments you can give, and if you want to reach out to us, we are available.